Diabetic foot exam. What is a diabetic foot exam? People with diabetes are at higher risk for a variety of foot health problems. A diabetic foot exam checks diabetic people for these problems, which include infection, injury, and bone abnormalities. Nerve damage, neuropathy, and poor blood flow are the most common causes of diabetic foot problems. Neuropathy can make feet feel numb or tingly. It can also cause a loss of feeling in feet. So if a person gets a foot injury, like a callus, area of thickened skin, or blister, or even a deep sore, ulcer, a person may not even know it. Poor circulation in the foot can make it harder for a person to fight foot infections and heal from injuries. Diabetic person having a foot ulcer or other injury may not be able to heal it fast enough. This can lead to an infection, which can quickly become serious. Untreated foot infections become so dangerous that foot may need to be amputated to save a life. Fortunately, regular diabetic foot exams, as well as home care, can help prevent serious foot health problems. Use of diabetic foot exam. People with diabetes should get a diabetic foot exam at least once a year. A person may need an exam more often if his/her feet have any of the following symptoms: tingling, pins and needle sensation, numbness, pain, burning sensation, swelling, pain and difficulty when walking. A person is instructed to call a healthcare provider right away if signs of serious infection are found. Symptoms of serious infection: a blister, cut, or other foot injuries that don't start to heal after a few days, a foot injury that feels warm to touch, redness around a foot injury. A callus, thickened layers of skin, with dried blood inside it. An injury that is black and smelly. This is a sign of gangrene, the death of body tissue. If not treated promptly, gangrene can lead to amputation, removal of a limb, of the foot, or even death. How a diabetic foot exam is done. A diabetic foot exam may be done by a primary care provider and/or a foot doctor, known as a podiatrist. General assessment. Healthcare provider will ask questions about health history and any previous foot problems. Will check shoes for proper fit and ask questions about other footwear. Uncomfortable shoes can lead to blisters, calluses, and ulcers. Dermatological assessment. Healthcare provider will look for various skin problems, including dryness, cracking, calluses, blisters, and ulcers. Check the toenails for cracks or fungal infections. Check between the toes for signs of a fungal infection. Musculoskeletal assessment. Look for abnormalities in the shape and structure of the foot. Vascular assessment. Use a Doppler ultrasound to see how well blood is flowing in the foot. Treatment. Treatments may include antibiotics to treat foot infections, surgery to help with bone deformities. There is no treatment for nerve damage to the foot, but there are treatments that can relieve pain and improve function. These include medicine, skin creams, physical therapy to help with balance and strength. Some useful information. Precautions to be taken to keep feet healthy. Keep blood sugar at a healthy level. Get regular diabetic foot exams. Get feet checked at least once a year, and more. Check feet every day. This can help find and address problems early before they get worse. Look for sores, ulcers, toenail cracks, and other changes in feet. Wash feet every day. Use warm water and mild soap. Dry thoroughly. Wear shoes and socks always. Make sure shoes are comfortable and fit well. Trim toenails regularly. Cut straight across the nail and gently smooth edges with a nail file. Protect feet from excess heat and cold. Wear shoes on hot surfaces. Don't use heating pads or hot bottles on feet. Before putting feet in hot water, test the temperature with hands. Because of reduced sensation, a person can burn feet without knowing it. To protect feet from cold, don't go barefoot, wear socks in bed, and in the winter, wear lined, waterproof boots. Keep the blood flowing to feet. Put feet up when sitting. Wiggle your toes for a few minutes 2 or 3 times a day. Stay active, but choose activities that are easy on the feet, such as swimming or biking. Don't smoke. Smoking reduces blood flow to the feet and can make wounds heal slowly. Many diabetics who smoke need amputations. Some illustrations of diabetic foot. Some illustrations of diabetic shoes. Thanks for watching. Please like, share and subscribe.